Digital health on the web. Since the year 2005 until 2015, many things have changed and have not changed, from when Gunther wrote his text. Even until now, the growth of e-health sites have grown and more are being created. The internet has grown and is regarded as one of the #1 sources for health information, secondary from a healthcare physician. This is why we are going to talk about the digital health on the web and the various ways one can use it and how it is currently improving.
There is a common assumption that people who use the internet, combined with the word health, assume that people are just online diagnosers, because they are using the famous Dr. Google. In 2005, Gunther stated that the web is a major source of health information. Even today, the internet remains one of the ways to access large quantities of information that would have taken huge effort to find. The digital web is more than just an online diagnoser who believes that their headache is a brain tumor, when in reality it may not be. Just because one person is looking for symptoms online doesn't classify them as an online diagnoser. It could simply mean that a person is just looking up health information they may want to know and could bring to the doctor for more fruitful dialogue. Although this phenomenon suggests that doctors are no longer regarded as the only authoritative source for health information, it does not change the fact that the doctor remains the #1 source, since the internet does not provide treatment and is just a secondary source. Users of digital information on health can be seen in many ways, where one can access websites provided by health information suppliers like the Stanford University's Highwire Library of Science and Medicine, which now provides access to huge amounts of scientific journals and articles. As of now, March 2, the Highwire is assisting the publication of 7 million articles, with its numbers showing that the website now contains over 3,000 publications, 7 million articles, and over 2 million full-text articles. Comparing it to when Gunther wrote his text 10 years ago, where he stated where Highwire only provided access to over 300 scientific journals. Now Highwire in 2015 has reached far above 2005, where one can now easily access Highwire's website through a mobile version through their smartphone. Easily, as compared to back then when browsing the web on their phone wasn't a tap away. Aside from the mobile version, the well-known site has provided a number of full-text apps through the Apple and Android store, which contains access to a number of apps and access to Highwire's journals and databases. One of the other health sources of information Gunther talks about is the NLM, the National Library of Medicine. In the text, Gunther talked about how the Foundation explored in making Medline, a database that was originally used by healthcare professionals, to be more accessible to the public. In 1997, Al Gore launched what we now know today as Medline Plus, a website that can be used for patients, their families, friends, educators, consumers, and healthcare providers. In a 2012 survey, patients were the #1 users who used the site with a percentage of 32, next to healthcare providers and then family and friends of a patient. So one can access information from disease, conditions, wellness issues, and drugs. The site is now optimized into both English and Spanish, and now over 150 million people access Medline Plus each year.
Health on the web can vary from many topics, but one of the most important topics is that it also serves as a digital health news source. The New England Journal states that the internet has become a critical medium for clinicians and public health care practitioners. One can hear about the latest epidemic, outbreak, or diseases on the news, but not everyone can catch the televised news. One can simply log on to the web to search about this type of health-related information. They can be able to search information on the latest epidemic, search the symptoms of that epidemic, to where it has been recorded at, and to the fertility rate. Websites like Health Map are a great example of digital health news source.
One of the greatest advancements in digital health and information today is that a patient is able to access their health records online from their healthcare provider's institution. Websites such as MyChart and Healthcare Portal are good examples of these types of programs. For example, my dermatologist uses neither, but uses ModMed from Modernizing Medicine, an electronic medical record that shows my medical information from prescriptions to past and future visits, medical history, and personal information. Practices and specialists from dermatology, ophthalmology, and plastic surgery use this program.
The web is also an online community and not just an information source. It is a community where people can get support about various diseases and disorders that they might have. In addition, they are able to connect with someone going through the same health concern, all through the web. For example, a patient going through cancer might not want to communicate with people that they know from home or in their social circle, but want to confide with others who are going through the same disease or with others who have conquered the very same disease they have. One of the last examples is that one person is able to look at information on how to remain healthy through online sites like SuperTracker. SuperTracker tracks one's exercises and calorie intake through the user's inputs. Although one cannot track all calories they eat, because food varies from calorie to calorie, it remains a very close summary. In addition, another website, for example, is letsmove.gov, founded by Michelle Obama. This health online source helps parents, schools, and communities to find easy and accessible ways to stay active and maintain a healthy lifestyle with children to prevent childhood obesity, all by using the web or using phone apps such as Facebook, Twitter, and YouTube.
Although the internet provides various ways of health information, and with the continuing growth of health websites every day, even today since when Gunther wrote his text, it is still a big question of trust and knowing if your information is reliable. With the growing of websites from health information to other websites coming from different parts of the world, it is important for users to have confidence in the authority of information and credentials of a source, as anyone can be an online author. Because of this, and the fact that health professionals will not always be able to provide guidance, it is important to know what is reliable and up to date. Just because it is online, it does not mean it's legitimate and should not be taken seriously, which is why information quality control is a major issue. 2005, Gunther talked about calls for a need for a systematic assessment on online health information and a need for development of normative standards, and that there needed to be a need for a system of labeling that can inform health consumers about the quality of the content of a particular site, and a need for information to be easily accessed and understood. Now health information online is getting to where it's easily accessed and understood. In February 2015, the search engine you know as Google added medical conditions to their knowledge graph, a system that they implemented in 2012 that provided users detailed information about a certain topic without having to search other websites. Google worked with a team of medical doctors led by Dr. Capel, who worked together to review all the information that would be put into the knowledge graph. The knowledge graph shows information about the disease, symptoms, and treatments, making it easier for a user to read all the information they might need instead of navigating a website where they might get more than they asked for. The way it works is that Google collects the information and then verifies it through a team of physicians, and then it's signed off through a website like Mayo Clinic, who they give credit to. However, just because Google added medical conditions to their knowledge graph does not mean it should be taken face to face. Google even stated that their information should not be taken as medical advice, as cases are different for every person, and that their goal is only intended for informational purposes only, and one should always consult a healthcare professional if they have a medical concern. After the statement, Google said that they plan to add more medical conditions to the 4 cases that they have online, which covers about 10% of all medical conditions that are searched online. They plan to go global by starting off with English as their first language for all medical conditions on the knowledge graph. 10 years ago, according to HON, it was reported 360 million people use the internet, while today it's estimated to be about 2.4 billion people who use the internet. This growth brings importance for quality control and reliability. One of the ways that Gunther talked about improving health information quality and control is when he talked about the idea of kite marks being floated around. Kite marks in the UK are quality certification marks owned by the British Standard Institution, where it is a frequently used method to identify products for safety, like, for example, ladders to ensure safety for a user. He also stated that online information can be classified in terms of topic, format, and audience. In 2001, the Health on the Net Foundation, to now, has become established as a respected and non-profiting-making guide to medical information on the internet. You might see the Health on the Net Foundation certification marks on sites like Mayo Clinic, who display their verification of certification on their website. HONF's mission is to guide internet users by highlighting reliable, comprehensible, relevant, and trustworthy sources of online health information, tackling the very obstacle that is the web. The way it works is that a web publisher of a health site sends in an application to HON for their website to be evaluated. It is then provided modification suggestions from HON through their 8 principles of criteria. After the site makes changes to the site from HON suggestions, it is finally reviewed by HON and then approved and delivered an official seal. One might wonder what the principles and credentials are for a website to receive an HON seal. They are authority, complementary, privacy, attribution, justifiability, transparency, financial disclosure, and advertising. Although HON provides a way of certification, the user must check and be cautious when looking at a site that has certification. One can click on the logo and get linked to the real certification to see if a site is up to date or if the certificate is even real. One does have to be cautious, as some sites that display HON certificate may not be real. Also, the fact that some sites meet different credentials for different types of certification, like Discern. Discern is different as its certification was originally for print material and has different guidelines from HON. One of the most important is the user can also log on to HON and report a site. But in the end, it is important that the user knows certification does not mean never go to the doctor. It just means that a site met a certain criteria that may be different from theirs. Even if sites today have improved, every site varies in terms of topic, format, and audience.
Consumer update and opinions. We know that health information is one of the most frequently sought topics on the web. Even internet users are using websites designed for healthcare professionals, which are now being navigated and rewritten to render them as more user-friendly to non-professional visitors. Even with the growth of users using health information on the net, one of the most important things aside from reliable information is that systems must be in place to safeguard high standards of healthcare and medical treatment. This goal is for both the patient and professional, with people not just searching for disease or illnesses. Some are looking into how to remain healthy and live a healthier life, and how to take care of themselves. In Britain in 2001, Nicholas, Huntington, Williams, and Blackburn found that most people did not come to the health website for information on specific illness or medical condition. Instead, they were generally more interested in information on general well-being or information to help them remain healthy. With concerns with the internet replacing doctors as the source of information, patients are searching for reliable information, but even recent studies show that the doctor is still the number one source for confirmation and information. NHS Direct Online. Gunter mentions about NHS Direct Online. National Health Service Direct Online is an electronic health information and advice services in Britain. It has been stated that the purpose of this service is to provide the public, rather than medical and health professionals, with access to reliable information and advice about aspects of health and medical care. NHS Direct Online therefore represents a rich source of health-related content for consultation and acts as a gateway to a wide range of other health information and advice sources. In April of 2014, NHS Direct Online was shut down. According to the BBC News, the shutdown was due to financial reasons because NHS was unsustainable. Today, there is a national telephone advice line service, 111, and 2 super sites. The 2 super sites will be a site for each department, with other very few sites just like NHS Direct Online. Another reason due to this shutdown was to make access to information easier for people. While reading the reviews about NHS Direct Online, many stated that it was very difficult to navigate and many were constantly being redirected to different sections from different sites for just health information that they were searching on. This is why Gunter has stated that with online information, the quality of the content is not the only factor of importance to the user, but the electronic information resources must be designed to facilitate ease of navigation around the content. Ease and quality are very important in navigation through an online health source.
Nobody said it was easy.
There are numerous types of users and a great diversity of people who use the web for health information. With the digital divide being more than the gap between demographics and regions' access to modern information and technology, it also comes to terms where there is a barrier between different types of users. Gunter states that women may be generally more likely than men to seek online health information. He also stated that 6 in 10 women with internet access has sought information versus fewer than 1 in 2 men. Gunter has also stated from 2001 that health information seekers were predominantly of middle year age groups. The 2013 Pew Research stated that other groups that have a high likelihood of being health information seekers include younger people. This shows that these past few years, the age group that seeks health information has shifted from a middle age group to a younger age group. According to the Care Plus Project research, while older people mostly prefer to be informed by word of mouth or on paper, while feeling less enamored with the telephone and not very comfortable at all with computer-mediated communication. This still raises the question on how the internet can be more simplistic for them to access health information. As the research stated, although older people express worries about the technology, internet use can be cultivated among the elderly. In conclusion, the web and the online community is growing, and this is only concerning about health information. The public goes online for many reasons, but the search for health information is one of the main reasons why internet users go online. From what we had stated before, the web can offer advice for online health users, which can help these users to make more preventative measures than before. In addition, many use the web for consultation on simple health information rather than consulting the doctor. This is why Gunter has stated that the computer would take over GP's gatekeeper role by 2020, due to the fact that the internet has become a major health information source and a support mechanism for public health services. MyChart, Modernizing Medicine, Health Portal, and email are all examples of how these health services today are taking over the general practitioner's gatekeeper role. There still needs to be more research done for digital health on the web, because the web is ever changing and is always advancing as time advances.
And I discovered that my castle stands